This is Trixie?
Twixie.
Twixie?
Yes.
Okay. So what's going on with Twixie today?
We noticed a little enlargement in her clitoris.
Okay. My tech told me, you weren't sure if it was male or female.
Well, to me, Twixie has always been a female.
Sure.
So, and she's acting like a male dog.
So she's humping and
Yes.
she's not fixed.
Now, that's the whole reason I brought her.
And that'll help some of the behavioral issues.
Okay.
Oh, wow. We have that structure protruding from the vulva. Feels like, probably a little bone in there. So a male dog has, there's a bone in the penis called the os penis.
Mm-hmm.
Now, sometimes we'll see in a female or a hermaphrodite, a little bone in there.
Mm-hmm.
A hermaphrodite is when you have an animal that has both male and female sex organs. It's not something that we see every day or even every month. Out of the 12 to 15 years I've been doing veterinary medicine, I've probably seen less than 10.
Now, the question is which internal organs she has. There's a pseudo-hermaphrodite, and then there's a true hermaphrodite.
A true hermaphrodite is gonna have both gonadal tissues. So you're gonna have both ovary and testicular tissue. A pseudo-hermaphrodite is gonna have external characteristics of one sex and the gonadal tissue of another.
Either way, it'd be like a routine spay. Doesn't really change the procedure or the outcome or anything.
Mm-hmm.
We still would remove those organs, and just like we would a normal female. The only thing that's different is she's gonna always have that protruding from the vulva.
Oh, really?
Yeah, we don't usually remove that. Doesn't usually cause them any problems or concerns.
The reason that we're not gonna remove the os clitoris is because it's too much of an invasive procedure to put her through just for cosmetic reasons.
But it makes you unique. You'd be special.
Okay.
And she'll live a normal life.
Twixie, she's my baby.
Sure.
I don't have any kids, so she's my everything right now. Whatever you can do to make her feel better, I'll be really appreciated.
Sure. What we need to do is get her fixed, schedule that.
Perfect.
All right, Twixie. Twixie, you ready?
Getting ready to go in and perform a spay on Twixie.
Why does it look like that? What's wrong?
Because she's a hermaphrodite.
No.
Yeah.
What?
Once we get in there, we'll see if she's got ovaries or testicles inside.
What? I've never seen that. Does she have both?
I mean, it's possible to have both, but that's gonna be very rare. All right, Kayla, here we go.
All right. Oh my gosh, is that a testicle or is
It
that
looks like it. It looks like a testicle. I would have to probably send this out for histopathology to really know for sure. It may have tissues from both gonads. All right, so we're good on this side. Now I'm gonna try to get to the other side.
Is there ovaries in there?
No, she's got the external genitalia like a female. She's got a vulva, and then
That's
she
crazy.
has a uterus like a female, but then instead of ovaries, she's got what looks like testicles.
This is crazy.
You thought this was just gonna be a routine spay, huh?
I sure did. I was not prepared for this one.
This was like the ultimate gender reveal.
Literally. This is so interesting. I've never seen this before.
And I've been practicing over 12 years, and this is my second one that was like this. All right, so all done, got uterus and testicles out. Let's go ahead and wake her up.
All right.
So surgery went smoothly. We're gonna send that tissue out and have it analyzed to see if it's all testicular tissue or if it's possibly both. Either way, though, Twixie's all done. She's recovering right now and ought to be ready to live a long, healthy life.
Hello.
Hello.
How you doing? Zeus is a 1-year-old Chihuahua mix that I've been seeing ever since he was a puppy. So what's going on with my buddy?
I thought he was having seizures, because he kept turning his head up and he was shaking, and I started to panic. So I took him to the emergency clinic and decided it was neck pain.
Okay.
And she gave him pain meds, and he seemed like he was fine. He was running, he was playing.
But then yesterday, I was just petting him, and he just squealed like I heard him.
Okay.
So we thought he was in pain again and decided he needed to come in and see Dr. Ross.
Did anything change? I mean, did he fall off of the sofa?
Well, when he gets a toy, he shakes it violently. Shakes it. And then in the backyard, we have a shed. I think there's a possum that lives in that shed.
Okay.
He runs out there and just slams the door.
Okay.
So we can see how he could hurt his neck.
What's going on, buddy? What I'm gonna do right now is kind of squeezing here. So when you get here, you can see he's flinching. Lets me know that he has feeling, and I'm not.
Doesn't like it.
Once we get back up to here, he's not doing it. So he has decreased reflex of his neck. Let me see him walk. The way he's walking, he's not dragging his limbs, he's holding his head up erect. So all those things are good signs. So the pain medication could be helping, but it also could be masking how he truly feels. The thing that concerns me is the reflex letting me know that he doesn't have full sensation of his neck. I do want to take some x-rays.
Okay.
With you guys' permission, we'll give him something to just kind of make him sleepy. We're not knocking him out, we're just making him feel relaxed. We want to make sure his spine is straight and make sure he's not fighting with us. We'll go over the x-rays. I'll see if we have any compression, see if we have anything abnormal that we need to worry about.
Okay.
Okay.
Come on, Papa.
There you go, Zeusy.
Hey, Joy, can you go get Mom for me? We have Zeus x-rays done, and I'm very concerned.
Hi.
This is your baby. This is Zeus laying on his side. What I was worried about was the cervical vertebra, so basically the neck. We don't have anything that I see on here that lets me know we have issues with the spine. So I think we're dealing with soft tissue trauma. Kind of like us going to the gym and overdoing it with weights that's too heavy. Next morning we walk in like this. That's gonna take time to heal. The reason Zeus could not feel anything in his neck during the exam is because anytime you have some soft tissue injury, you have decreased nerve innervation. Therefore, you're not gonna feel that initial pain. No different if you're sitting on your hand and it goes numb. I wanna add an anti-inflammatory on as well. More muscle relaxant. Don't put anything around his neck.
Yeah, the harness we have actually wraps around his belly.
Okay. Anytime you have a dog that comes in with some type of soft injury around the neck, you wanna use a harness because a harness takes all that pressure from the neck and puts it on their sternum and their chest. So let's do the harness, decrease activity.
How do we keep him from, like, when he grabs one of his toys and just shakes it like a crazy dog?
Well, that's gonna be hard. Maybe get him toys that he has to eat a treat or peanut butter out of. If Zeus is shaking his head vigorously, he could pull a muscle in his neck. That muscle strain could have contributed to the soft tissue injury around his neck.
Once it's healed, he can get his toys back.
You can't put on like a little neck brace.
No, we don't want him to have on a neck brace. But when you see him going to town shaking, just say no.
Say no to you. And that's gonna hurt Grandma as much as you.
But looking at him, he'll be fine.
Thank you.
Zeus should be back to his normal self in a couple weeks. Because Mom can learn to tell Zeus no.
Okay, you gotta eat them fast, they're gonna melt.
Oh, thank you. Thank you.
You brought them for us, right?
That's because
She's the baker.
For us, right? You brought them for us.
Hold on now.
What you doing?
What am I doing?
I don't even eat dessert, but that's technically a fruit.
A fruit for me. Oh, these look good too.